Did you know that Africa is currently facing a significant mental health crisis due to soaring unemployment rates and high cost of living? According to experts, the unemployment rate in Africa is projected to reach 7% by 2024, with Nigeria already at 5%. This is largely attributed to weakened economic fundamentals, as reported by the World Bank in February 2024. The situation is further aggravated by the lack of structural economic reforms, which has led to an increase in mental health disorders. The rising cost of living is making it increasingly difficult for low-income earners to make ends meet in Africa. While there are no recent statistics on the number of people suffering from depression, Africa ranks 15th in the world for the frequency of suicide, posing significant challenge for the region. To address this pressing issue, some African governments have taken steps to establish mental health acts, with Nigeria signing its own act in 2021. Experts emphasize that addressing mental health should start with tackling unemployment rather than just focusing on mental interventions. During a summit on international mental health reform and care in Africa held in Abuja, Nigeria, stakeholders from various sectors emphasized the need to address the root causes of the mental health crisis to bring about meaningful social change in the region.
There is no health without mental health. And where there is no health without mental health, in other words, you can't achieve anything as it were outside of mental well-being. So it's very important that we prioritize the mental well-being of African descent. It is very important that we see that mental health reforms of the colonial masters, all the mental health reforms that have been archaic and obsolete, are repealed across the African countries. We want to see new branded standard mental health reforms that will support the current realities of the mental health demands for the African descent.
Mental health is always spoken from the narrative of the medical science. And some persons are not too comfortable with that. So we're advocating that going forward, mental health should be addressed from the point of job creation, employability, workspace, because without mental health, these things are not possible. So the generation of our youths who are unemployed would be interested in issues that can enable them gain employment. And if mental health is driven from that narrative, it could help promote decent job creation in Nigeria.
Youths are kind of faced with, a lot of information that they don't even know how to react to or what to do with them. And mental health in itself, affects our well-being generally. And you will see statistically, not only, something that is, prevalent just here in Africa, it's a global epidemic, right? That lots of young adults has been complaining about, their health from the mental health perspective, and that has to do with, the ability to be able to harness all those information.
Speakers stressed the importance of political will and urged governments to prioritize funding and care to make psychosocial service accessible to all, while also combating the stigmatization of mental health in Africa. In the case of Nigeria, experts highlighted the urgent need for the government to increase the number of qualified psychiatrists to provide care for all citizens.
Government have a responsibility. There need to be some legislation to assist the medical setup or medical institutions to have more funding so that they can take care of this group of people. Economic situations that most nations of the world, and Nigeria inclusive, are going through has given rise to so many situations where people who normally yesterday were well suddenly can become challenged today mentally because too much of thinking, so many things are happening.
We are here to actually shed light on this lack of data, lack of research analysts, and lack of professionals in the field, because we also have a lack of professionals in the mental health space. We have a lack of psychiatrists, we have a lack of psychologists, clinical psychologists, as well as other psychologists, healthcare providers, nurses, all these things. We are understaffed. We have one psychiatrist to at least, I think, about a million people struggling with mental illness, which is a huge disadvantage that we suffer as a nation.
Reports have revealed that Nigeria is the seventh largest country with mental health challenges and is the fifth most suicide-prone country in the world. Shockingly, only 10% of those in need have access to the care they require, accounting for approximately 15,000 out of every 100,000 recorded suicide globally. This underscores the critical need for immediate action to address mental health challenges in Africa. Vincent Okushi, reporting for Quality Television.